Now, today we are discussing the youth and sexual health.
So far as there's what connection that brings about exchange of fluid, why not? So it could be kisses, sexual intercourse, that's where there's what semen and vaginal fluids. But of course, it affects the youth because of that youthful exuberance. You want to explore, you want to, when you get to a certain stage, advice is not it's not a factor at all, you understand? You want to explore, you want to get there.
Hi, wonderful family, and welcome to Youth Trendy Vibes. This is your community that will always give you the vibes to stay trendy and connected. Now, today we are switching gears from love to wellness, and your health, your priority, your health, your wealth. Now, on today's topic, we are sparking on a vital conversation that will have to do with the youth and sexual health. Yes, the youth and sexual health, where we would explore the complexities of STIs and a bit of unintended pregnancies. Yes, and so join the conversation as we delve in the world of youth and their sexualities, as well as throwing more light on the importance of education and awareness, as well as creating positive impact on the lives of the youth. Joining me now is a doctor by the name Dr. Eric Banyaboa, who is a highly experienced, dedicated, respected, and seasoned senior physician assistant at Ewing Polyclinic here in Cape Coast. So he will offer us the expert perspective on this topic on board. Welcome, Doc.
Thank you very much, my dear.
It's so good to see you and meet you finally.
Yeah, it's a pleasure as well.
All right. Now, today we are discussing the youth and sexual health, and we are tailoring it around STIs and a bit of unintended pregnancies. Without much ado, we would want to know, what is STI, or what are STIs? Are they just letters, or there are more to it?
Well, there are more to it, if I may say.
Okay.
But before I proceed, let's look at the words.
Okay.
STIs, sexually transmitted infections. Well, as the name denotes, they are kind of infections that are acquired through the activity of what? Sexual life, or through the activity of what? Sexual intercourse. As we engage in this, of course, there are a lot of interplay. There's exchange of fluids and sort of get it. So what it means is that a disease possessed by one person is likely to be transmitted to another person, because it takes two to have sex. You understand? So all the diseases that are associated or that are transmitted through sexual act is what we term sexually transmitted disease. And of course, sex can be in the form of oral, it can be anal, and it could be, of course, could be the traditional means, that is what, through a vagina, penile interplay. Okay. That's what we term sexually transmitted infections.
So you heard Doc right. The activities that we engage in, and he made mention of a whole lot. And so the infections that are contracted through these activities. Doc, we would want to know, what are most common STIs affecting young people of today?
Well, so from where we stand, we can group the STIs into different parts, you understand? Okay. We have those that are caused by viruses, we have those that are caused by bacteria, and have those that are caused by parasites.
Okay.
For instance, if you talk of those that are caused by bacteria, we have the chlamydia infection, we have the syphilis, And of course, we have the common one, gonorrhea.
Okay.
These are the common bacteria transmitted with sexually infections.
Okay.
Understand? We have the viruses. The virus, we have the common one, HIV/AIDS.
Okay.
We have the herpes simplex virus. We have the human papilloma virus as well.
Okay.
And of course, we have fungi infection, which mostly affect women.
Okay.
That is what we call the candida or candidiasis. Yes. So these are in group different types of sexually transmitted diseases that you are likely to encounter when it comes to our various health facilities.
All right. So you had Doc right. We have a lot of them: bacterial, virus, and what have you. We have made mention of some of these diseases or infections, that affect the young people of today. Talk of gonorrhea, syphilis, chlamydia. You heard Doc, right? I can't mention all. Now, Doc, we would want to know the common mode of transmission when we come to these STIs.
Well, as alluded earlier, the infection is acquired through the sexual act. You get it? In the process of sex or in the process of intercourse, there's exchange of fluid, there's blood and other fluid, as we made mention of. And as this exchange goes on, there's what? Transmission of these bacteria or the viruses from an infected person to the other. As I indicated earlier, it could be through anal sex, it could be through oral, and it could be through the vaginal penile interplay. Understand? So through these means, you're able to acquire these infections. When there's a break in this transmission, then of course there wouldn't be any infection. The person who hosts the bacteria or the viruses is the only person who is going to have the symptoms or have the disease. But so far as this keeps on going, then of course the person is going to transmit you to the next person. So regardless of the fact that you are male to male or female to female, so far as there's connection, that brings about exchange of fluid. Why not? So it could be kisses where there's exchange of saliva.
Yes.
You get it?
Sure.
It could be sexual intercourse. That's where there's semen and vaginal fluids.
Yes.
You get it? And these fluids contain much, or they are places where the agent causing the diseases are in their match numbers. You understand? So as you keep on exchanging them, why not? It's a package, of course. Anything good or bad that is contained in that fluid, also, of course, is also shared.
It's a package. So someone will be like, oh, when I met him, I did not have sex with him. We just kissed.
Yes.
Just kissed? There is more to just kissing. It's not just. It contains a lot. I hope you are learning something. So if you do not know the medical status of the person, please keep away. Stay away. Stay back. You know that. Okay, Doc, we would want to go further. How can we determine that someone has gonorrhea or syphilis or any of the STIs? So basically the symptoms.
Well, so that is where we all need to be very careful.
Okay.
A lot of us are dressed nicely, moving about, doing our own stuff. Yeah. There are things that we contain, that we are carried, that you have no idea. You understand? So you don't need to look at it from the physical point of view to ascertain whether I am free from any of these diseases or not. You understand? Because some of these diseases are not likely to be exhibited physically for you to see, and because they mostly affect our private part, you are likely not to see. So if you see me dressed nicely, move about, and of course you want to do anything with me, it's up to you. You understand? So what I'm trying to say is that before one can be able to exhibit any signs and symptoms, the worst would have happened within the person before. So the signs and symptoms are the latter part of the disease that is likely to be exhibited. That notwithstanding, we have few of them that we can make mention of. For instance, we have discharges. It could be vaginal discharge, or it could be penile discharges. There could be itchiness for the women around the vulva, as well as the men. There could be frequency of urination. You urinate frequently, but what? Scanty. The next moment you are urinating, another moment you get it, which is unusual. And it comes with some level of pain, which is also what? Unusual. So these minor ones can advance to cause what you call systemic infection. That's why the person is likely to exhibit some fever, headaches, and those which are not specific to what? The disease. You get it? Because they have advanced to affect other systems. So the person is going to exhibit what? Systemic signs and symptoms of disease. Get it? So these are, in a nutshell, the various signs and symptoms one is likely to what? Exhibit. We have specific to specific diseases, but because of time factor, we wouldn't want to dive much into it. We give the general signs and symptoms for people to take note of.
I know that you are learning something. Are you experiencing any of these? Please rush to the hospital. And as Doc made mention of, you wouldn't see with your eyes. You wouldn't even know why a fine boy, fine girl on a now Charlie or do and you Charlie, there is more to it. As I always say, there is more to it. Doc, we would want to know, is there an age factor or age limit as to how or when a person can be infected with an STI? Let's say,
there's nothing like that. But of course, it affects the youth. Basically, I think because of that youthful exuberance, you want to explore, you want to, when you get to a certain stage, advice is not a factor at all. You understand? You want to explore, you want to get there for you to experience before. So we realize that these are the people who are always caught up with the conditions, unlike the young ones, unlike the elderly who might have experienced life, and of course everything appears to be old to them. But basically it's the youth who are trying to explore in all dimensions. They are likely to be infected with these. So if you ask me, from my own perspective, there's no age factor in any way, because the disease is not immune with respect to age. You are not immune with respect to your age. Rather, it's about taking care of yourself very well. And we believe that the youth exploit more, and because of that, they get exposed much more better than the younger and the elder generation.
Thank you. You are a youth. I am a youth. We are youth. Let's take good care of our lives. Let's take good care of our health. Hey, now, Doc, we would want to know this. A partner will be negative even after several contacts with a positive person or partner.
Oh yes, it's so possible. In medicine, before one get contracted to a disease, understand, a whole lot of factors come into play. Your immune system would fight the disease. We need some quantum of the infectious agent to be able to cause disease. Your diet, everything come to play for one to be able to get a particular disease. You get So in so doing, you might have stronger immunity, or the agents or the infectious agents you were exposed to were not enough to cause the disease. You understand? So these are the factors that come into play before one gets infected with a particular disease. You get So the quantum of the infectious agent is key here. Your immunity as well plays an important role, and many other factors come into play. You get it? So that means that not all people or all of us may be exposed to the same disease condition, but I might get infected, you may not get, because of where we stand with respect to what I've just mentioned.
Okay.
So it's possible. And again, I must also say that yes, some of the diseases have a prolonged incubation period.
Okay.
The incubation period is the period between the exposure to the what? Onset of the disease. You get it? Some can even last for years. If you take syphilis, for instance, it can be in the system for many, many years, even 30 years. You'll still be harboring the infectious agent. You understand? Okay. So these are the factors that ought to be considered before one can be said to have what? Been infected. Okay. If you take HIV, for instance, the same thing. It takes longer incubation period for the disease condition to what? To come. Okay. You understand? So sometimes you may get a virus, but not AIDS.
Okay.
So these are the dynamics.
So this is to say that if your partner is positive, that does not justify that you're also positive. Yes, because your immune system might be stronger and that might be fighting all these diseases or infections. But wait, make sure that you do something about it. All right, Doc, we would want to debunk some claims surrounding or some myth surrounding STIs and its transmission.
Yes, there are lots. Sometimes some are just laughable. Really, really laughable. Especially if you get those are people who, are taking the title doctors. I mean, the herbal people who have taken themselves doctors and, explaining diseases from their own point of view and managing diseases from their own point of view. Sometimes it's quite scary though. Some people will tell you that yes, if you get gonorrhea and it's not well treated, it migrates to syphilis. If syphilis is not well treated, it migrate to what? HIV. And it's like, these diseases do not have any link in any way. Okay. You understand? So these are some of the things that, of course, we need to clarify and, in fact, demystify, because it's quite scary. And these people, they have voice. They are heard everywhere. Yeah. They are heard everywhere, even better than those of us who call ourselves professionals. You understand? So that makes it very, very difficult, and the people buy into it easily and use those informations. And I believe that yes, as a nation, we need to be very proactive and work on it. And I think this particular program is in a good direction, and that's why I'm really into it, to help debunk some of the false information that is making way on our waves.
Now, there is this thing. So a friend might have syphilis or gonorrhea. Is it that if I eat with their spoons, wear their clothes and all others, like I will get infected or something? Because you made mention of fluid. But if they eat with a spoon, I eat with a spoon, is there some transmission there?
Yes, it depends on the kind of diseases we are talking about. Okay. If you talk about the hepatitis B and those things, yes, those things are likely to happen. Okay. Those infections are likely to occur. Okay. However, the percentage is even so minute compared to blood transmission and other vaginal or the seminal fluid. Okay. These contains more infectious agents than the saliva. So using somebody's spoon is likely to expose, but the percentage rate is very, very low and sometimes insignificant. Okay. But as I said, we need to be very careful. So I wouldn't debunk that totally that yes, let's look at that area as well, so that we don't underestimate any factor.
Okay. So if the person has any of these STIs, do not run away. Do not run away. Or what you do at Now, Doc, we would want to know if these diseases are curable, and if they are, what are some of the common treatments, modes of treatment, sorry?
Yes, some are treatable, some are manageable. Okay. If I say treatable, it means yes, they can be cleared off the system completely. Okay. And if I say they are manageable, it means that yes, they are diseases that cannot be cured.
Okay.
However, you can, based on some routines, you can suppress the complication the disease is likely to cause. I must say that diseases caused by viruses do not have a cure. So if you take the hepatitis B, you take the HIV, they don't have a cure. You get it? So we manage them.
Okay.
We manage them in such a way that yes, the viruses wouldn't complicate. Yeah, the viruses will be in your system. They will be what? Dormant.
Okay.
Unlike the bacteria causing STIs, yes,
Okay.
for them we have stronger antibiotics in the system that are used to treat. So we have them. For the sake of not abusing drugs, I personally wouldn't want to mention particular drugs and sort of get a hand.
Okay.
I rather advise that you seek professional medical advice when you think you have any of these diseases. Because of course, as soon as you go and mention this here, somebody will say you heard the doctor mention this on the wave that this can cure. No, I don't want to happen this way.
Okay.
Yes. So I must say that all the bacteria causing STIs have cure. You understand? There are potent medications in our various health facilities to be used to cure them. However, the viruses, as I mentioned, HIV and hepatitis, they are manageable.
Okay.
And of course, if you visit us, we also have a better way of taking you through treatment, the various treatment modalities.
Sure. So they are curable. They can be treated. If you find yourself in this situation, that is not the end. That is not the end. Visit the nearest hospital and you might find treatments for that. So we've talked about this, but I think we need to throw more light on it. Are there resources available for STI testing in our local communities?
Yes, definitely. The only challenge is because they have some sensitivity. Yes, about it. People are very reluctant to even visit the hospitals for management. Get it? So before they come, they would have used other treatment modalities, sometimes unprofessional ones, making it quite difficult to manage. But I must say, yes, our health facilities are resourced enough, at least, to manage these conditions. There are big conditions that are almost impossible to manage in our part of the world, but of course STIs is nothing that I would say it goes beyond us. It's something we can actually contain, so our health facilities are resourced enough to curtail this menace in society. So I would advise the youth that anytime you have any signs and symptoms pertaining to any of the STIs, please visit any health facility around you and confidently tell the doctor what you are going through. And of course, based on his professional knowledge, he will be able to help you out before complications set in. So I must say yes, the health facilities are well resourced.
The health facilities are well resourced. Do not sit there, please. Do not sit. I repeat, meant no hole. Visit the nearest hospital for professionals to take good care of you and also cure you of whatever infection you are battling with. Doc, we would also want to know something. How important is regular testing, and how often must one go for testing on STIs?
Yes, it depends on where you are coming from.
Okay.
Of course, if you're a woman, there's this human papilloma virus. These viruses are responsible for causing some cervical cancer.
Okay.
Get it? So it's always advisable for every woman in the reproductive age to test this or to do these tests every year. And when it comes to HIV, of course, it depends on your own lifestyle.
Okay.
If you think you are safe, even that, you can't be 100% safe. Any opportunity that you get, you should be able to test. Now, the good news is that the health facilities have what we call wellness clinic.
Okay.
These wellness clinics are attached to the hospital. you can pass there anytime you want to do any test. You get it?
Okay.
Not necessarily going to make a card or do folder or whatever. You can just, oh, today I want to check my sugar.
Okay.
Today I want to do HIV test. Today I want to do this. And they are what? You'll be more than willing to do that one. So you wouldn't go through the normal stress you will go through when you go to the hospital. Because that alone scares people away. Yes. Hepatitis B, you should be able to test. Okay. And when you test, you are negative. Of course, there are what? There are vaccines there to protect you and your siblings or your family. Get to have. And of course, anytime you have any symptoms that I mentioned earlier, the burning sensation or the pain on urination, the discharges and what have you, you shouldn't hesitate. Move to any health facility and do the test. So that notwithstanding, every opportunity that you get, please do test. I wouldn't say that if within a month do the number of tests, do the no. I wouldn't say that. Okay. Yes, but based on where you find yourself, you should be able to know that yes, you require to test for any of these diseases.
At any point in time, you can test. There is no specific time for testing. So make wild, do wild, and then be visiting the wellness clinic to be checking all these at all times. Doc, we would also want to know this. Does STI or do STIs affect mental health?
Definitely. STI do affect mental health. By definition, mental health is what? The state of well-being, the state of your psychological, physical, and then emotional well-being. You get it? So anything that affects your health affects your what? Your mental cycle. And especially these chronic illness, HIV, hepatitis B, and human papillomavirus. These diseases, which cannot be cured but rather managed, go a long way to affect you, because it more or less shuts you down, and because society also has some stigma attached to it. You get it? So it keeps you isolated from society, it suppresses your happiness and what have you. So yes, STI can go a long way to affect one's mental well-being.
Oh yeah, some more. Now, Doc, just as we made mention that stigmatization is on the rise when you find yourself in this situation, how can we reduce the stigma around STIs?
That's a long way. We have a long way to go on that aspect, because I don't know whether it's ignorance, act of ignorance, and of course society has some perception about people who carry this kind of infection, that yes, it's because of their promiscuous life, and that yes, they are seen in a different way. You get it? So society naturally shuns at them. They wouldn't want to get closer and sort of. And these people are at risk of. That's why these people sometimes, when they get opportunity, instead of protecting others, keep on infecting people.
Sure.
Yes. So I believe that yes, as a group or as a country, we have a very long way to go on that. We need to increase the education level to let people know that yes, some people have this promiscuous life leading to that, but we have equally innocent people who were just infected, and therefore we need to embrace them. And disease is no respecter of person. It can affect you, it can affect me.
Yes.
Therefore, anytime we see anytime we see any person in this situation, all that the person requires of us is what? Love and care. We shouldn't shun the person's presence, or we shouldn't stigmatize the person, but rather we should show the person the kind of love you would have expected to be shown.
So if you meet someone facing this or these, show the person love, show the person care, bring the person close to you. In as much as you are distancing yourself from this disease, do not isolate or shun the presence of the person. I know you have learned a lot, and we are still on it. But Doc, the final question to bring to an end this whole discussion is there a link between STIs and unintended pregnancies?
Well, of course, there should be a link.
Okay.
Any person who gets a STI is also likely to get or be associated with this. That is to say that yes, men are also part, but of course men cannot get pregnant.
Yes.
So far as you are not using the right device, the right protective agent, and you should get STI, it means yes, you are likely to get pregnant or get somebody impregnated. So they go together. They go together. If you're able to use the protectors, something to protect yourself, yes. And of course, as it stands, it is only the condom that can, do that dual purpose job. That is to prevent unwanted pregnancies and at the same time prevent one from acquiring STI. You get it? Okay. So they go together. Other means, of course, there are other drugs you can take to prevent the pregnancy, but there's no drug to prevent the STIs.
Okay, so there is a link between STIs and unintended pregnancies. So far as you did not protect yourself from getting pregnant, you are not protecting yourself from acquiring this STI as well. The last one. This I heard from somewhere, and it was like the person was saying that a person or a child can be born with HIV. How true is this?
Oh, there are a lot. There are a lot of, yeah. We have a group for them even.
Okay.
Yes. For now, because of advancements in technology and medicine, there are ways to curtail that so that a pregnant mother wouldn't transmit that to the child. Okay. But previously, yes, the knowledge was low because of that. A lot of innocent kids have been to this world having the HIV even from day one. There are now drugs that are given to them while in the uterus and when they are born, and also to prevent mothers from breastfeeding. You understand? So there are people who are born with HIV from day one. But as I said, there are people. The advancement in medicine has reduced that. Because people are not assessing this important treatment modality. They hide, give birth, and sort of forget it. Those who want to give birth home and those sort of hands. So they don't have access to this information. So they are still getting people giving birth to children with HIV. But those that pass through our health system, they are screened, they are treated, so that this child come out being negative.
So if you find yourself pregnant once again, even if it's unintended, visit the nearest hospital for every checkup, and you might find yourself and your baby safe. This is the end, or will bring us to the end of the discussion. I know that you have enjoyed this conversation to the max, just as we are all enjoying it here. Thank you so much, Doc. God richly bless you for the insights.
It's always a pleasure.
And also a very big thank you to our sponsor, 24 Sam Studios and 24 Rentals. If you need a photographer for your photography, your photo shooting and all that, your videography and more, you would want to contact 24 Sam's Studio, located at Mfansipim Junction on the Starlet 91 Road, adjacent Vice City Barber and Shop. And also, if you think you cannot come around, just give us a call. You can call us on 0245 619403. 0245 619403. And also 24 Sam's 24 Rentals. It says Pixels Redefined. Now, if you need top-notch media equipment like drones, cameras, stabilizers, lenses, light setters or light setups, studio spaces and editing spaces for your podcast and all that, visit 24 Rentals. We are same We are at same location at Infantipim Junction, the Starlet 91 Road, Cape Coast, near the Vice City Barbering Shop. You can still give us a call if you need any of these media equipment on 0245 61 9403. I repeat, 0245 61 9403, and we will service you or serve you to the we will serve you right. My name is Inshira Becker, your host for this show. We will meet again, but until then, remember to stay trendy and connected. This is Youth Trendy Vibes.